Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. We are broadcasting live spine surgery today. Our patient travels here from Florida, and he's had 5 years of neck pain. It is Thursday, September 26th. This is our last surgery for today. His pain is coming from the facet joints. He has a fusion in his neck, and the pain is coming from above that. It's C2-C5. It's on both sides. We're going to be going in and basically deadening the nerves causing his pain. It's all done with a small probe. It takes a 4mm incision. It's going to take about 20 minutes to do the procedure. It's outpatient. He goes home the same day. We are broadcasting from Deuk Spine Institute as we have been for 10 years. All of our surgeries live. Shot. All right. There is number 2. I can see the lateral mass of 2. It's going to be higher up. Yeah, 2, it's off to the left there. There. That's the target pretty much right there. And then 3, and then 4, and then 5. And then I think he's fused. So I'm going to go a little bit higher. Have we numbed? Yes. Incision. If you have questions, feel free to ask. In the meantime, Henry, would you show our audience how is it these facet joints can cause so much pain?
Of course.
What's the mechanism? Welcome back. You can see facet joints cause pain through inflammation. Inflammation is a process, is that it? It is a process whereby your body tries to repair things using inflammation. And the inflammatory system actually isn't just a reparation system, it's a destructive system. So the first thing your body does in an injury is it destroys. All right, just kind of like think about, the Russians are now bombing Ukraine. They come in, they bomb a city, and they destroy buildings, right? And then the first thing you do is you bring in the bulldozers and the excavators and all that heavy equipment to break down the rest of the building. You demolish. So the first step in rebuilding a city is demolition. And it's no different in the body. This patient, his body is trying to rebuild these areas that are injured, specifically the facet joint capsule. Shot. So we're going to come in here and we're going to help. And the way we help is by basically killing the pain nerves that are causing all of his discomfort. They located in a specific spot. That's right where we are. Shot. And we are at C2, the back of C2. Shot. And I'm just probing, trying to get the right spot. So I'm moving from the back. Can you take my hand out of the window? Keep the top window where it is, but go ahead. Good. All right. Oh, my hand turning green. He has a deep neck, Sean. Very deep neck. And we're not rotated, right? Good. I'm feeling the actual target bone right now, Sean. I just want to make 100% sure that we're in the right spot. Shot. All right. If you have questions, feel free to ask them. I'll do my best to answer. Moving down to the next level.
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is this procedure is performed?
That would be great.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantage of plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We're localizing our targets and attacking and burning the pain nerves. Right now I'm just using the X-ray machine to identify those targets. And Jordan, help our audience by seeing, okay, that's a good one right there. Show us exactly where the tip of the probe is right there. That is where the pain nerve runs, okay, at the waist of the lateral mass. Now go down a little bit, show them the arthritis of that facet joint that we're looking at. And you can see the bone spurs, huge bone spurs. That's the process called arthritis. And the arthritis is what causes all the pain, stiffness, discomfort that the patient experiences. We cannot fix arthritis. Doctors have no way to cure it except to cut the joints out or fuse them. And that's an option. We talked about it. It's not a good option under these circumstances. A much better option is to go in and destroy the pain nerves responsible for the pain and suffering that comes along with arthritis. We call that a rhizotomy. Rhizotomies were first used a long time ago for treatment of pain to a painful joint. Got a little feedback on the mic, your end, Henry.
Oh, I apologize. I thought it was turned off. How's that?
Yeah, we're good. Cool. All right, that is good. Shot. Now he has, I'm just going to go a little bit lower because you can still see some more arthritis below where I'm working, and I want to make sure we get it, all the pain fibers. Yeah, that's perfect. And I'm going to go to the other side next. Any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience the 30 causes of neck pain?
I think it's a great idea. Let's do that.
Copy that.
I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see from our video, 30 causes of neck pain, that there are 30 common causes of neck pain. And the most common being the disc problems. This patient, though, doesn't have disc problems. He has facet problems, like so many patients. It's not his disc that's causing pain, it's his facet joint. And he may also have a disc problem. I'm not 100% sure. But right now we're treating his facets. And he clearly has facet pain. We're going to address that first. Shot? All right. So we're at C2 right now. And I'm basically severing pain nerves. Severing means cutting. And these pain nerves, all they do is cause pain. And it is a standard procedure. It's known to other people as radiofrequency ablation, but we're not doing radiofrequency ablation. We're doing the Deuk plasma rhizotomy. The general term is called rhizotomy. Rhizotomy means to cut the pain nerve. That's what we're doing.
We have a question
Sure.
coming from Raj on YouTube,
Hi, Raj.
saying, "Hi, doctor. Can some disc herniations and facet joint injuries be asymptomatic? If so, and why? And if so, would you advise them to do? Thank you."
Great question, Raj. Great question. So the question is very smart. The question is, Dr. Deuk, you get an MRI, you see an abnormal disc. It's injured, herniated, bulging, slipped disc, protruding disc, whatever disc. Or you see facet joints with arthritis. And the patient has no symptoms. What should you do? The answer is do nothing. Don't treat it. Leave it alone. Treatment can only make matters worse. Every treatment we do as doctors has risk, no matter what the treatment is. So you don't want to have risk of a procedure causing a problem for you that you didn't need that procedure. You cannot make a disc problem any better than asymptomatic. Asymptomatic means you have no symptoms. So that's what we want. We want your facet joint problem, your disc problem, to not cause any symptoms at all. That's the goal. So if you're already there, there's no reason to do treatment, because we can't do better than asymptomatic as doctors. That's all we can do. Great question. We're just about done, another minute, and we will be finished. Any other questions?
At this moment, no current questions.
You can see the severe arthritis in that picture. Jordan, can you show the audience that? Yeah, all that blackish gray, dark gray is hypertrophied bone, thickened bone. The way you get thick bone is from arthritis, stress, instability, they call it. But your body will stabilize it. Your body can't get rid of the pain, though. That's where we come in. We get rid of the pain. All right, what else do we need to show them?
We showed the 30 causes of neck pain, the cetogenic, and how to cure for cetogenic neck pain. We could definitely show them what is the main causes, or what happens when we get a herniation on our neck. We could do that.
Sure. Let's
Okay.
show them how a disc injury causes so much neck pain.
Exactly.
That last one.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. We just showed you the most common cause of chronic neck pain, which is a disc injury. I have a lot of scar tissue here on the right side, but I think we were able to get all the pain nerves treated. We're now down into his fusion mass. You can see he's fused down here. All right, I'm very happy with that. He will have a sore neck for about a couple of weeks. This surgery does hurt. There's no way to make it so it doesn't hurt. But we can reduce inflammation by putting in some anti-inflammatory medicine. All right, you can see the incisions are tiny, little incisions. They're 4 millimeters each. We're going to put some staples in, and we'll get them out tomorrow. These are Band-Aid incisions, but they are incisions. Surgery is done with an incision. Minimally invasive. It's the back of his neck. We fix both sides. Any other questions?
No current questions.
All right, he's going to go home in about 30 minutes. So I would call that a successful procedure. The only other treatment that works is fusion, and he would have major pain and all the complications related to fusion. So this is a much better surgery. All right, Henry.
Of course.